Okay, I think we can get started. Good afternoon, everyone. My name is Shauna Spicer, and I'm the Alumni Relations and Annual Fund Officer with the Lawrence Bloomberg Faculty of Nursing. Thank you for joining us for today's Alumni Lunch and Learn session, where we will hear from Navisha Weerasinghe, speaking on environmental sustainability in our health systems. Before we get started, I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Hira-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still home to many Indigenous people across Turtle Island, and we are grateful to have the opportunity to work on this land. I'm now going to cover a few housekeeping items for today's event. Since there are so many of us, we ask that you stay muted throughout the presentation. We welcome you to enter your questions or comments in the chat box, and there will be a Q&A portion at the end of the presentation. This session will also be recorded so we can share it with those that were not able to join us today. We will send you an email after the session, which will include the link to the recording, as well as an opportunity for you to provide feedback. It is now my pleasure to introduce today's speaker. Navisha is a second-year PhD student at the Lawrence Bloomberg Faculty of Nursing at the University of Toronto. Navisha is a registered nurse currently working as a clinical operations manager at Halton Healthcare and a staff RN in the emergency department at Brampton Civic Hospital. Navisha's experience as a research assistant with the Center for Sustainable Health Systems sparked her original interest in advancing environmental sustainable care and health systems through research and practice. Her research interests include critically examining the role of the medical industry and the proliferation of single-use medical products, hospital infection control practices, and patient safety in relation to environmental sustainability. Navisha hopes that through her doctoral research, she will be able to transform the environmental sustainability of health systems through meaningful policy and practice changes, in addition to mitigating the ongoing climate crisis. I also have to mention that Navisha is a proud alumna of Bloomberg Nursing's Master of Nursing program in 2021. Thank you for joining us today, Navisha. Over to you.
Thank you so much for that introduction, Shauna. Hi, everyone. As Shauna mentioned, my name is Navisha, and I'm really excited to be here today presenting in front of all of the U of T nursing alumna that are here today. As Shauna mentioned, I'm a second-year PhD student, and in this Lunch and Learn, I will be discussing my PhD journey so far, and as well as where I am in terms of my studies. I do want to apologize in advance. I am still getting over my cold, so I will be drinking lots of water throughout the presentation today. So if we want to get started, next slide. So in terms of today's agenda, I will first start with an introduction and discuss my pathway towards pursuing my doctoral studies. I will then discuss what I've done so far in terms of my PhD journey, and what I've done with my literature review for my study, which is one of our first-year PhD student milestones in the nursing program. Next, I will share the basis of my study proposal and next steps and looking forward towards candidacy. And to conclude, there will be a question and answer period after at the end of the presentation, and I definitely look forward to discussing aspects of my presentation further there. Next slide. So this kind of image here depicts my pathway towards my PhD. So starting off in 2017, I graduated from the bachelor's with my bachelor's in science and nursing from TMU, Toronto Metropolitan University, formerly known as Ryerson, and started working in a medical surgical unit at Georgetown Hospital. And if you told me during that time that I would be doing my PhD studies now, I definitely would not believe you. It definitely seems a lifetime ago. So I worked at the in the med-surg unit for a year and a half, and then I wanted something a little bit more challenging and new. So I moved into the emergency department in 2019 at Brampton Civic Hospital. I fell in love with emergency nursing here, and I'm still currently at both organizations. And I'm so fortunate that the organizations I work for have been really supporting my pursuit of my doctoral studies and allowing me to be flexible in my work hours. In 2019, I also started my Master of Nursing in the clinical program at U of T. And in 2020, I continued my master's studies, as well as I continued working in the emergency department during COVID. And it was also in my master's that I actually met my now supervisor, Dr. Quinn Grundy. Quinn has been a pillar of support even before starting the PhD program. She's been an amazing mentor and guide, and I would definitely not be where I am today without her support. In 2021, I graduated from my MN and I started taking other roles, and I worked as a clinical instructor with U of T as well. And it was during this time period that I actually reached back out to Quinn as I started to think about pursuing my doctoral studies. And this is where I started working as a research assistant for the Cascades Project through the Center for Sustainable Health Systems. And I will come back more to the specifics of what this project is later in my presentation. And then in 2022, I started working as the clinical operations manager at Halton Healthcare on a part-time basis. And I was also accepted into the PhD program, which was definitely a surreal moment for me and my family. I remember when I got my letter, it was actually around the time that my dad first immigrated to Canada 30 years ago. So it was definitely a very exciting moment for me and my family, being the first person in my family to pursue doctoral studies. So that was definitely exciting. And so this brings me to the present day. So I'm currently in my second semester of my second year of my PhD studies. And yeah, so I just wanted to kind of give that brief background of where I came from and where I am today. Next slide. So why U of T? So while reflecting, there were a couple of things that were coming up for me. So one being the community. When I first started my master's at U of T, faculty support was amazing. I felt very supported by the faculty, and it's nonetheless in the PhD program as well. Starting from first year into now, I feel like the faculty is very supportive of student success. And I feel very comfortable with going to faculty, asking different questions. And the faculty here have been a great resource. So I'm so lucky to be in this program, as well as peer support. I met a great, and I had a great amount of peer support in my master's, and that only transpired into my PhD studies as well. Initially, I actually thought pursuing my PhDs would be a little bit more isolating because we're all doing different research, but it's been the exact opposite. There's so many opportunities for PhD students to interact, and upper year students are very available to answer questions and share their progress and pathways as well. So the peer support has been great. As well as resources. So U of T has an immense amount of resources. And before applying to the program, I felt like it would really help with my education and training while pursuing my PhD studies. So for example, U of T has what is a unit called the Center for Critical Qualitative Health Research, who the Lawrence S. Bloomberg Faculty of Nursing is actually affiliated with. And they have different resources and course pathways for doctoral students to become experts in critical qualitative health research. So I'm actually currently on one of these pathways as I'm conducting a qualitative study. And I've actually completed 2 out of 3 of these courses. And it's really helped me build my skills as a novice researcher. Lastly, funding has been a tremendous support. So funding and donor support has been really helpful for me as a PhD student. With the support we receive from donors as PhD students, I'm really fortunate to be able to devote majority of my time to building my research program and not having to work full time, which has made all the difference in terms of completing my PhD studies. So that has definitely been a lot of help. Next slide. So in the slide, I'm just going to talk about why environmental sustainability, why am I interested in this? So as a nurse working at the bedside, and as I mentioned, I've worked in various clinical roles, I've witnessed firsthand the excess amount of waste generated as a result of patient care activities. And so, um, while working at the bedside, this struck me as very unsettling, and I always thought there must be something more that we can do. However, as a nurse, I've also experienced the conditions of care work that make it extremely difficult to think about environmental sustainability at the bedside, and I'm sure a lot of nurses on this call can relate to that, such as increased workload demands and staffing constraints. And I just want to highlight, although there is little literature in this area, most literature suggests individual micro level interventions in changing behavior amongst clinicians to promote the environmental sustainability. However, by promoting research and suggesting interventions like this, it actually takes away and makes invisible the largest systemic factors at play here that contribute to the environmental unsustainability of our health systems and makes invisible health systems' role in the climate crisis. And so I was always aware of waste while working clinically, but it's when my now supervisor, Dr. Quinn Grundy, when I took her theory course, History of Nursing Ideas in first year, that we had a week on environmental sustainability in health systems. And this was the first time I was actually exposed to it in an academic setting, and where I was able to conceptualize the environmental sustainability of health systems first. And so these experiences led me, thankfully, I was very fortunate to have a research assistant position at the Cascades Project through the Center for Sustainable Health Systems. That's affiliated with the Institute of Health Policy Management and Evaluation at U of T. And one of my committee members, Dr. Fiona Miller, is actually the director of this center. So Cascades is a $6 million multi-year capacity building initiative funded by Environment and Climate Change Canada. And this project is actually ongoing and aims to build a sustainable and resilient Canadian health system as the climate crisis intensifies. So during my time as an RA, I conducted rapid literature reviews on ward waste and was able to interview key stakeholders at various hospital institutions and understand how they have been leaders and change leaders in terms of building the environmental sustainability in their organizations. Next slide. So this is just some screenshots of some of my work that's published on the Cascades website, and all this is open and can be accessed through cascadescanada.ca. So I was able, during my time as an RA, publish what we called a primer, which was a rapid literature review on ward waste. I was also able to interview some really great nurses from Sick Kids that implemented a waste audit at their institution at Sick Kids. And so we have a series called Cases and Faces of Sustainable Healthcare. And I was also able to develop some blogs, which was a different way to mobilize knowledge and promote knowledge translation in other creative ways. And at the end of my presentation, I do have a bunch of different resources linked to the environmental sustainability of health systems. So those will be at the end. Next slide. So now I'm just going to share my stats and building towards my literature review. Next slide. So the World Health Organization has identified the climate crisis as the biggest global health threat of the 21st century. And if global health systems were a country, they would be the 5th largest emitter of carbon emissions. Next slide. Hospitals that make up a majority of our health systems are highly resource-intensive facilities that require significant energy use and are large producers of waste as they are open 24/7. Hospitals in Canada generate roughly 29 pounds of waste per patient bed per day. And it's clinical activities that are the major driver of resource utilization and waste in healthcare. Next slide. And so according to the World Bank, There are approximately 2.5 beds per 1,000 people in Canada, hospital beds. So therefore, in Canada, there are roughly 95,625 hospital beds. So this is approximately 2.7 million pounds of waste being generated daily by hospitals in Canada, which is an alarming number. And so in an effort to treat illnesses, hospital systems have inadvertently created new health issues as a result of day-to-day operations. And it's important to acknowledge that health systems' ongoing contribution to the climate crisis make them extremely environmentally unsustainable. Next slide, thank you. So just to provide a definition of what the World Health Organization defines as environmentally sustainable health systems. So these systems improve, maintain, or restore health while minimizing negative impacts on the environment and leverages opportunities to restore and improve it for the benefit of the health and well-being of current and future generations. Next slide. So next I will be diving into my literature review, which is part of my PhD work. And here again, I would like to acknowledge my supervisor, Dr. Quinn Grundy, and my committee members, Dr. Fiona Miller, who I mentioned, who is a professor in the Institute for Health Policy Management and Evaluation at U of T, as well as Dr. Lisa Cranley, who's an associate professor at the Lawrence S. Bloomberg Faculty of Nursing. My committee members and their expertise have been really supportive and have shaped my research thus far. And I really look forward to continue working with them in the future in terms of my research proposal and my study. Next slide. So as a first-year PhD student, the first-year milestone is completing a literature review in the area of research you hope to pursue through your doctoral research. So in the next few slides, I will share some key findings that I have found through my scan of the various literatures that will inform my proposal development. And so this will look at 3 different pillars, which include patient safety, infection control, and the medical device industry. Next slide. So patient safety. So there has been some research conducted that has suggested that environmental sustainability practices at the point of care are seen as a competing priority to patient safety in healthcare professions such as nursing. So there was actually a focus ethnography done back in 2021 in an emergency department in Alberta that found that environmentally responsible practice was viewed by nurses as incongruent with nursing care priorities and was misaligned with infection control practices. So participants in the study said that they did not have enough time to think about environmental sustainability in their practice based on their workloads. And they noted that patient safety was their priority. And so in this study, some of the results showed that they did not consider, the participants here did not consider environmentally responsible practice as a part of patient safety. So the participants in this study also noted common practices such as bringing extra supplies into patient rooms, especially when patients were on isolation, as a means to save time and manage workload. And other literature suggests that narrow perspectives of some patient safety visions are also potentially problematic and harmful to the environment. There was a paper published by Rowland and Kiddo in 2014 that did a Foucauldian discourse analysis of patient safety in the hospital setting. And patient safety discourses are primarily concerned with the biomedical prevention of adverse physical events. And this actually promotes a limited view of patient safety. And lastly, infection control is also seen as a critical component of patient safety and is aimed at the prevention of spread of nosocomial infections or hospital-acquired infections. The high mortality rates as a consequence of hospital-acquired infections demonstrates hospital consequences imposed by the healthcare system onto patients. And hospital-acquired infections are one of the greatest risks to patients while in hospital, and this is very well known among health systems. So decisions made to mitigate the risk of transmission of infection in hospital settings are often associated with patient safety principles. And so they're both very well integrated. Next slide. So I'm going to be moving more into the infection control piece of this now. So infection prevention efforts reduce the risk of disease and the associated delivery of additional healthcare services through proactive approaches that actually focus on preventing infections from happening at all. So prevention of this sort is actually considered pro-environmental. On the other hand, infection control is reactionary and involves managing known infections by attempting to mitigate the spread of infection to other individuals. And while this is definitely necessary, infection control and their associated practices can have implications on the environment. The discipline of infection control also conceptualizes patient safety with no limitations in protecting patients from hospital-acquired infections. And this understanding might have implications on the environment in terms of how products are procured and which products are procured. And something that is called the culture of over-preparedness amongst point-of-care workers to have supplies readily available in the case of deteriorating patient. Now, there is some literature that has been published where hospitals or teams have tried to green their practices by implementing supply checklists in their units as a way to mitigate the overtaking of supply use for patient care. Lastly, for infection control, so as we know, the COVID-19 pandemic also demonstrated hospitals' reliance on material products, such as single-use medical devices and PPE, to control the spread of disease. And this has resulted in an astronomical amount of healthcare-related waste post-pandemic. And this waste has exposed an urgent need for health system transformation. Next slide. So next, I'll be going into the medical device industry and the proliferation of single-use products. So among various infection control strategies to control hospital-acquired infections, as we know, that's one of the greatest risks to patients, products are viewed as a key tool to mitigate the risk of these infections. But when we look at the history of infection control, it is littered with commercial product materials and products which have been marketed to prevent infections and are widely promoted by manufacturers. And throughout this history, the medical device industry has generated considerable competition among manufacturers in the development of single-use medical products, driving profit. So the trustworthiness by medical experts towards the industry and transition to single-use products is of concern, as these devices may be driven by factors beyond infection control and patient safety, such as profit, convenience, ease of use, and physician preferences. Also, the continued increasing uptake and use of single-use medical devices and supplies is largely accepted as a means of infection control and prevention. But in the literature, there is actually no compelling evidence that suggests that this is the case and that this would be superior over proper cleaning or reprocessing of certain medical devices. And in addition, single-use products are also associated with additional health and safety risks. So, for example, a 2020 study published in the Journal of Clinical Endocrinology and Metabolism found that single-use products were associated with high rates of exposure to endocrine disrupting chemicals. Lastly, for the medical device industry, they have significant power to oversee and become the regulators of medical supplies. And the lack of national and professional consensus and mandates for reprocessing medical supplies had left institutions such as the Center for Disease Control and Prevention in the States deferring to manufacturers' instructions for use in terms of how these products are disposed of or how they are managed. And so this actually diverts a lot of power to manufacturers. And this can actually have harmful environmental consequences where manufacturers may regulate supplies on the premise of profit rather than infection control and patient safety considerations. And this then furthers generates waste and pollution. Also, interestingly, single-use medical products are also approved for use faster than products that may require reprocessing or cleaning. And so all of these aspects are important to consider when understanding the current state of our health systems. So that was kind of my literature review in a nutshell. So I'm going to be moving towards my proposal now. Next slide. So my proposal, so where I am in my PhD right now, as a second year, I'm done all my coursework, so I'm really building my thesis proposal this semester and hopefully defending it this year. So right now, I'm working with my committee to build that. So just to backtrack in terms of what the research problem is, so the climate crisis continues to pose a significant threat to planetary and population health. And in Canada, healthcare is responsible for approximately 4.6% of Canada's emissions, which is a significant amount. Single-use medical products are being extensively used to control infections in hospitals. However, there is no compelling evidence that suggests that hospital-acquired infections are actually reduced or that this keeps patients safer. The promotional activities of the medical device industry and relative lack of regulation has contributed to this proliferation of single-use products, contributing to increased carbon emissions through the manufacturing and transport of these products and the subsequent waste that's generated. The medical device industry could alleviate healthcare's contribution to the climate crisis by doing things such as reducing packaging, looking at how kits are developed, greening supply chains, or using other sustainable materials. We know, and there's been research that's published, that the medical device industry has extensive representation in hospital systems, and industry representatives and information are heavily integrated within procurement processes, practice-based education, and clinical support. However, whether and to what extent interactions with the medical device industry occur within the within the context of hospital infection control is less understood. Sorry. Okay. So although healthcare is meant to heal, there are significant harmful environmental impacts related to patient care activities, which is paradoxically causing harm to patients. Sorry, I'm just going to mute myself for 1 minute. Sorry about that. Okay, next slide. So this takes me to my study proposal. So this is still in the works. I'm still working with this with my PhD committee. So we're still finalizing things. The working title for my study right now is Interactions Between the Medical Device Industry and Hospital Infection Control and Impacts on Environmental Waste, a Critical Ethnography. And in my study, I'm really my aim and the ultimate goal of my work is to generate new knowledge around the interactions between the medical device industry and hospital infection control to inform future hospital policies and processes that consider the environmental impacts of these interactions. And I'm really looking into looking at the tensions between environmental sustainability and hospital practices. And in terms of methodology and methods, so as I mentioned before, I am doing a qualitative study. So I will be conducting a critical ethnography. And my methods will include observations, interviews, and document analyses. And this will be in the hospital setting. We're still working out. I'm not really sure if this is going to be a unit specific or across multiple hospitals. And that's also to come. And I'm working towards kind of finalizing all of that with my committee. But this is kind of just the foreground of my study proposal. Next slide. And so just coming back to my pathway, so I'm really hoping again in 2024 to reach candidacy in my PhD work. I really truly believe this work is extremely important, and it's also very important for nurses as well, as we are, with patients the most 24/7, and we actually see this waste and handle products and have opportunity to be able to change systems. So I'm really excited to see where my study will go and where it will take me in terms of my career and my research program. And that brings me, next slide, to the end of my presentation. Thank you so much. I really hope that that was informing somewhat. Just go to the next slide. I think Shona will send this PowerPoint out later, but I do have a list of resources here. If you're interested in learning more about environmental sustainability in health systems, the different work that different organizations are doing. There's also different training opportunities, I know, at the Center for Sustainable Health Systems that you could potentially, if you're interested in, take part in. And I think just the next slide is my references. But thank you so much again for listening, and I look forward to answering questions.
Thank you, Navisha.